Drug abuse and addiction. Drug abuse is the use of a drug for purposes other than those intended by its manufacturer or for which it was prescribed. It is a widespread problem in many societies across the globe and one that has been linked to numerous health issues and other negative consequences. Drug abuse can lead to physical dependence, addiction, increased risk of overdose, and social harm such as crime and violence. Physical effects and mental effects of drug abuse. Physically, drug abuse can cause an array of health problems ranging from nausea, vomiting, headaches and seizures to organ damage and even death. Long-term use of drugs can increase the risk of developing infections, chronic diseases such as hepatitis C or HIV/AIDS and addiction. Additionally, substance abusers are more likely to experience accidents due to decreased motor control or impaired judgment. Causes of drug abuse. Biological causes can include genetic predispositions towards addiction as well as physical changes in the brain caused by prior substance use. Environmental factors can also contribute to drug abuse. Definition and types of drugs. Drugs are classified into two main categories: legal and illegal drugs. Legal drugs, such as alcohol, tobacco and some prescription medicines, have been approved by the government for use in specific circumstances. Illegal drugs include marijuana, cocaine, heroin and methamphetamine. Sign and symptoms of drug use. One of the primary signs and symptoms of drug abuse is changes in behavior. When someone is abusing drugs, they often display changes in their typical behavior such as increased fatigue, irritability, aggression, or anxiety. They may also neglect their usual interests and hobbies that they used to enjoy doing. Additionally, a person who abuses drugs may have poor hygiene, rapid weight loss or fluctuation in appetite. Changes in sleeping habits are another common symptom of drug abuse. Consequences of drug abuse. The use of illicit drugs, such as heroin and prescription painkillers, can lead to addiction, health complications and even death. Prolonged drug abuse can also cause lasting damage to the body, including organ damage and weakened immunity. In addition to physical harm, drug abuse can have drastic psychological and social effects. People who are struggling with addiction may face issues with their relationships, job performance and finances. Drug use can also increase the risk of developing mental health disorders like depression or anxiety. Prevention strategies. The most important part of dealing with drug abuse is prevention. Creating an environment of open communication between children and parents is one of the best ways to prevent drug abuse. It's also important for parents to recognize any warning signs that their child may be experimenting with drugs or developing an addiction. Another effective strategy is increasing access to resources like counseling, vocational training and community programs for those who are at risk for using drugs. Having professionals available to provide support and guidance can help people make healthier life choices. Conclusion: Understanding drug abuse. At the conclusion of this video, it is evident that drug abuse has a serious effect on both individuals and communities. It can cause physical and mental health problems, financial hardship, unemployment, crime and even death. Therefore, it is important for everyone to be aware of the dangers associated with drugs in order to recognize signs of drug abuse and take appropriate action if necessary. By taking an active role in tackling the issue of drug abuse, we can make our communities safer places for all.